plan was to start about 1:30, kind of with comments from folks who wanted to share stories about Dr. and Diana Guthrie. And so we're about at 1:30. So I'm going to have Matt kind of mute everybody except those that are talking, and Rhonda's first up from the PA school. I'm going to have each one of them introduce themselves. And then my sadness is that Dr. Guthrie's not here today. As many of you know, today would have been his 85th birthday. We're sad that he's not here to join us in this event. So I'll let Rhonda start. And then folks that are speaking kind of know their sequence of talks, and I'll let you just introduce yourself and move forward until 2 o'clock when we start the program.
Thanks. Hi, everybody. I'm Rhonda Hanneman. I'm the program director at the PA program. Been a family medicine PA here in Wichita for over 20 years. Some of our students are joining us today. Colby Schinkel has signed in. Laurel has signed in. We'll have a few more joining us as they finish up an exam this morning. It's really good to see everybody. I haven't seen a lot of these faces in many, many years. Sue Nyberg is really sad that she couldn't join us today. I think a lot of you know Sue. She's been with the program for 24 years or so. But I wanted to share a few words about Dr. Guthrie and Diana. Dr. Guthrie was one of our very first physician preceptors for the PA program, and he served as one of our clinical preceptors for probably 30 years or so. He started back in the early 80s, back when it was really hard for PAs to find physicians to precept us. But he was a very steadfast and early supporter of the PA program, and he just was consistent and faithful to our program for many, many years. I know when I was a PA student back in the 90s, I got to spend some time with Dr. Guthrie and learned so much from him. And Sue, who was a student in the early 80s, said that Dr. Guthrie served as one of her preceptors as well. And then Kim Darden was the program director before me, and she did a rotation with Dr. Guthrie, and she said that was the best popcorn she'd ever had. He always had popcorn available for his students. And he just made such an impact on the lives of so many PA students and PAs in the community. And we learned so much about caring for the pediatric patients and as well as our adult patients. And I actually did the diabetic educator program with Debbie and Diana and Dr. Guthrie and some of you others, back in the mid-90s. And it was when Lantus first became available. And it was just, I can't believe how far we've come since then and all of the different insulins that are available. But I'll never forget just the impact that all of you had on my life personally as a provider and as a practitioner, but just how respectful Dr. Guthrie was towards young students and his patients, and I just don't have enough good things to say. So thank you for having this event and letting me share just the wonderful memories that I have. Thanks.
I think I might be next. Is that right, Lindy? So I guess I'll just go ahead and say thank you again, like Rhonda did, for having this event. This is kind of a miracle to pull this off, and so memorable to have it on Dr. Guthrie's birthday. We always had a celebration, and for Diana, we always have a celebration with strawberry shortcake, which we should have done today just because. But Lindy asked if I would make a few comments, particularly on behalf of WSU nursing, diabetes educators, and camp. And I thought, oh, I'm really honored to be able to do that. And I've known Diana for a long time. Well, I counted it up, and it turns out it's 46 years. So I thought, wow, maybe I better pull up Diana's CV just to be sure I don't say something wrong. Well, that's 27 pages, and there's 29 letters after Diana's name. It is just amazing to see what a living legend, literally, that Diana is. And, when I kind of was just reviewing things in my mind, I thought Diana's academic excellence is truly that lifelong learner is that piece about Diana that's outstanding, but it's absolutely paired with determination and service. And you look at Diana, and Diana, I see your quiet nature, but I'll tell you, people should not underestimate you because of that. But when I was looking at Diana's CV, one of the things that was striking to me was that her education started in 1953 at Graceland. And she, of course, was a board member for them later. But her education was consistent and nonstop for over 30 years. Missouri and ending with a PhD at Walden with her concentration in behavioral science. And that was a span of over 30 years. And of course, we know academic appointments at Wichita State in nursing, but she also had a joint appointment when she and Dr. Guthrie came to Wichita. He was, of course, recruited to chair the founding chairman for pediatrics, but Diana had a pediatric appointment as well. And it was the University of Kansas, the Wichita branch. So the University of Kansas School of Medicine, the Wichita branch. And do you remember, Diana, that we had our offices in the dorm? We had little dorm rooms for offices and class. And I think I'd been there about 3 weeks when you and Dr. Guthrie went to an international diabetes meeting. I was horrified. But the certifications that you have accumulated have started with community health and counseling, and every academic degree, you have added that level of expertise to show the world that you've got the expertise in all of those areas. So it's been amazing. And then I got to the publications section of your CV, and there were 24 books and monographs, 33 chapters, and I don't know how many pages of journal articles. Absolutely a legend, absolutely a pioneer that you have led us and guided us. And of course, I met you when I was a nursing student and followed you around like a little pup. And when you asked if I wanted to help with diabetes camp, I'm like, oh, sure. I've been to 4-H camp. I can do this. Well, I got to that very first diabetes camp in the mid-70s, 1974 actually, and I knew nothing about diabetes. I knew nothing about kids with diabetes. I remember sitting on the bunk with a little girl who'd never given a shot, and the syringes were horrible and the needles were long. And she cried and I cried. And the other little campers were like, hurry up, come on, we've got to go eat. We want to go canoeing. But, my job interview, I've always said, was when I took them for a hike and they were discovered to be missing. And this whole little cabin was listening to me tell the wide mouth frog joke. And when the search party found us, you, Dr. Guthrie, Nature Max, the camp director, everybody waited patiently while I finished telling the joke. And I've always thought, gosh, that was my job interview. Because years later, when Dr. Guthrie offered me the job to work with you, I was working as a staff nurse at Wesley, and I was on faculty at community college nursing department. And he said, would I like to work with you? And I said, oh, no, I'm too busy. He said, well, just think about it. And when he got on the elevator and the doors closed, I'm like, oh my gosh, what did I just say? So Monday morning, I was at the medical school HR department trying to get the paperwork signed. And they were, of course, horrified because, the job hadn't been created, the job wasn't posted, they hadn't interviewed for the job. But I've got to tell you, it tickled me because that is the nature of your success. you and Dr. Guthrie saw things that needed to happen, and you made it happen. And so I've always thought no one should tell you no. So, the things you've done for Wichita State, though, that are so striking, of course, is to be such a strong faculty member for the Department of Nursing. And the diabetes specialty course that you set up for graduates I was in that first class. Lindy graduated there, Judy Friesen. So many of us were able to have academic confirmation of our diabetes skill. And then, of course, you went to Yale and helped them develop their graduate program, helped them set theirs up. But I think one of the things, besides the patient education program that you established, that has helped thousands and thousands of people with diabetes and their family and caregivers and care partners become educated and successful, I think your forte is professional education. And when you developed the Diabetes Education Update Program, I think that had not just national impact, but I think that had worldwide impact, because healthcare providers came from all around the country for this week-long comprehensive diabetes education program. We had 25 faculty members, and then 5 or 6 of them stayed for the didactic that next week. And they followed Lindy and Dr. Guthrie and everybody in clinic, and they went to the hospital. And, sometimes they got a vitriol appointment or a podiatrist site visit, but that had people come from all around the world. I mean, you remember the Hong Kong nurses stayed for a month. They didn't just come for 2 weeks, but lots of people came back for a refresher. Some people came because they had failed the CDE exam, and after a week or 2 weeks with us, they passed it. And then I just feel like everybody was inspired when they left. But I've got to say, really, your hallmark, I think, is your determination. And we needed a dietitian to help teach class. Well, you invited Virginia Stuckey. I have no idea if there was any money that changed hands. But then the next thing we know, here she came for the first class, and she had Judy Friesen in tow. And she said, this is who will be your dietitian. So between you and Virginia, you got Judy Friesen on board. And then I remember one time we needed tabs for the education manual. We couldn't get it approved. There wasn't any money. No one could afford it. So you ordered the books, and you ordered them with tabs, divider tabs, so people could find the next section. And I know you paid for that out of pocket, like you did a million things. But I remember probably one of the most striking things that you've never really admitted to, and that was when we needed more space for patient education class. Somehow, out of the blue, I got a call from St. Francis, and they offered us a room. We could remodel it however we wanted to, and we could come and start anytime. I know that was you that was behind that. And somehow you got Lindy and me both on faculty at Wichita State. So I think, again, a word of advice, don't say no to Diana Guthrie. But just as I kind of close, I just have to say thank you. Your innate gift is helping people be successful while you inspire them to be part of something bigger than themselves. So thank you, Diana Guthrie, for all you've done for all of us.
Thank you, Debbie. Nate's up next.
All right, everybody hear me okay? Good. My name is Nate Wheel. I'm a pharmacist for Auburn Pharmacy in Garnett, and graduated from the KU School of Pharmacy back in 2007. I met Dr. Guthrie in June of 2006, and I had just started my clinical rotations at Mid-America Diabetes Associates. I was lucky enough to land there in the summer months so I could attend Camp Discovery. Debbie was my preceptor. It was one of the best experiences of my life. Looking back, I can't help but think that that experience changed my career trajectory for the better. My first year at camp was an absolute blur. It was just information overload. One thing I remember best was Dr. Guthrie's presence, just simply his presence. His knowledge of diabetes was incredible to me. And he was adored by absolutely everybody. And the realization that there was not one, but two Dr. Guthries to learn from just about made my head explode. It was just so much information. Diana was a wealth of information, and I, like a sponge, I just tried to soak up as much of that knowledge as I possibly could. Thankfully, my learning experience wasn't limited to the few days of camp that year. I got to stay a month at Mid-America Diabetes Associates with Debbie, and Deb helped me. I cannot remember your dietitian's name. She was fantastic. Susan, yes. I learned so much that month. It was definitely it was a life changer. And when Dr. Guthrie and Diana needed a little help doing a remote clinic, I think it was in Wamego, I jumped at the opportunity. And me and another pharmacy student, we rode with them up to Wamego. We listened to cultural anthropology lectures on the way on CD. We stayed in a mediocre hotel, and I think we saw 100 patients if we saw a single one. We saw so many patients. I was scrambling to do blood pressures and foot exams and just trying to soak up all the knowledge I could get while they were managing dozens and dozens of patients that day. That was my favorite rotation. Again, it changed my life. My desire to incorporate diabetes management, diabetes education into my career ultimately decided where I took my first job, a job I still have to this day, the job that's afforded me the ability to go back to camp every year since 2006. My second year at camp was one to remember or one to forget, depending on how you want to look at it. We all got a crash course in how to manage diabetes with the added twist of a norovirus outbreak. And it was truly awful. Kids and staff were getting sick all over the place. Blood sugars were plummeting. I had 5 glucagon kits in my pocket running around. Thankfully, never had to use a single one. It was awful, but looking back, very, very educational. Norovirus was not the only thing that was contagious at camp, however. While in its infancy, Dr. Guthrie brought something to camp that also spread from person to person. Empathy. Dr. Guthrie was one of the most caring, loving, and empathetic men I've ever known in my life. And I don't think it's any coincidence that some of the highest caliber people, some of the people with the greatest moral character I've ever come across, I met at Camp Discovery. I'm a better person for attending Camp Discovery. I'm a better person for knowing Dr. Guthrie and Diana. For several years, I was the only pharmacist that volunteered at camp. Slowly, more pharmacists got involved. I'm proud to say that pharmacists and pharmacy students now make up a significant portion of the camp staff. And I hope that continues when we get to resume camp. Thanks to COVID, I missed camp for the first time in 15 years. Summer wasn't the same. Looks like summer is not going to be the same next year either, unfortunately. We'll bring it back. Once we get on the other side of this pandemic, we'll bring it back, and we'll bring it back strong, because we have to. If for no other reason, then we have to do it for Dr. Guthrie. So thank you for inviting me to speak today. Have a wonderful weekend. God bless you all.
Thank you, Nate. Dylan Moore is going to say a few words now from his perspective as a camper. And so Dylan, take it away.
All right. Hi, everybody. My name is Dylan Moore. I've been a type 1 diabetic since about 2002. I think one of the first people that actually helped educate me on my diabetes was Debbie Hinnon. Like right after I got out of the hospital, we had a class there, and I learned, quite a bit in that short amount of time with my parents. And they were scared to death about everything, but it's kind of just how it is. I attended camp both as a camper, and I've been a staff member for quite a few years. I've only ever missed a year because of, I think, a knee injury, and I guess a global pandemic. We'll throw that one on there too. So as long as I can attend camp, I've always been happy. It's probably what I think is the best place on earth. I've always had a great time there. I've met some of my best friends there, and all that was mainly through the efforts of people like Dr. Guthrie. I remember back when I was a really young kid, when I was there, I think I was 11 or 12, we had a Kiss a Pig event, which was something for the kids that raised money to choose it was either a staff member or another camper to either kiss a pig. And I remember a couple years, Dr. Guthrie would actually dress up as the pig. He had on this big regalia and some fake glasses and a fake pig nose and some makeup, and he would kind of run around squealing and grab a kid and kind of press his nose up against him and everything, and it was really funny. And I kind of realized later as an adult and going through college and pharmacy school and everything that he was one of the people that and we did that event because we used to use porcine or pig insulin, and he was one of the main people, the driving force behind that not having to be a thing anymore for us to use recombinant human insulin. And so it kind of dawned on me later that really we probably should have been giving him a kiss, and probably the pigs too, but it's kind of hard to get them to cooperate. But I just wanted to say thanks to all the people in his life that enabled him to do that and participate at camp and everything like that, because I remember as both as a staff member and as a child, he would always try to remember our names and talk to us and learn something about us, and he would always remember from year to year. And I try to do that with the kids, and it's very difficult. Like, they'll get on you if you call them the wrong name, but he was always very sharp and would always get it right, and both him and Diana. And Diana would also do things with us like mindfulness exercises, and we did some like breathing and yoga, and it was always just great to interact with them, both as a young man and as a adult going through camp, and try to really get the kids to like, hey, these are like legends. You need to listen to them, like, or else we'll get you in trouble. We'll make you sit out of the pool. You better be nice. But and also just through the years and through all the staff that Nate talked about it a bit, like pharmacy students and medical students going through camp, how important it was for them to be able to listen to him and really learn from the things that he set forth and set the culture of camp. I think it was very important just for all those students to learn from him. Like, we used to not have that many students go through there, and now even the ones that I have, as I've started to get more involved in pharmacy school, some of the people that went back there or not went, but went to camp, they told me that they learned more in that week than they had in their entire time in the classroom about diabetes, just how it really is to live with it. And because you only see a snapshot of it when you're in clinic, but when you're at camp, you really learn how things affect us, and it's more the entirety around their life that it allows them to manage their diabetes. And it's not just you take this amount of insulin for this amount of food and things like that. It's a lot more than that. And so I just want to thank him for the culture that he set forth and that allowed that to happen, because now we're able to reach a lot more people and help a lot more people because of that across the nation. And it also helped me. I wouldn't be where I am today in pharmacy school or even medically, without the advancements of human insulin and camp and all that stuff, and learning from people like Nate and Lindy and Diana and everybody. I just want to thank you all for what you've done, because I wouldn't be where I am today without you guys. So thank you so much.
Thank you, Dylan. And Dr. Pate from the KU Med School is the next person to speak. It's all yours.
Hey everybody, can everybody hear me okay? Great. This is personally just such a privilege to be here today. Thank you, and to hear all of these wonderful stories. And it's really an honor for me to be here and be able to say a few words on behalf of the University of Kansas School of Medicine, Wichita campus, and the Department of Pediatrics. And Diana, I see you there. And even though I'm going to speak about Richard, you know that we honor you through our conversations about him. And really, so much of what I have to say is about the two of you. If there's a picture of a power couple in Webster's, it would be of the doctors Guthrie for sure, and your impact. So certainly, Diana, I honor you today with my words and remembrances about Dr. Richard Guthrie. So, you know, I certainly know of Dr. Guthrie as a clinician and researcher in endocrinology, but I have to honestly say I think I know him as an educator and as a leader in academic healthcare. And I think that it's so important for me to ask you to let me sort of zoom out and talk about the impact that Dr. Guthrie has had and will continue to have on this campus and all the things that we do as an educator and as a leader in academic healthcare. You know, independent, certainly part of, but independent of his really difficult to describe impact as a clinician and researcher in diabetes. I think all of you know that Dr. Guthrie was one of the founding fathers of this campus and the first chair of the Department of Pediatrics. And, you know, just imagine that for a moment. And I could speak for a long time about the legacy that he has left through those roles. But just a few things, and when we think about the fact that this campus has become really, if not the, one of the main engines that drives healthcare and access to healthcare all across central and western Kansas. The physicians that graduate from this campus that populate our residency programs truly do populate the state. In fact, in the Department of Pediatrics, the department that Dr. Guthrie founded today, 70% of our graduates end up working in the state of Kansas as either general pediatricians or as specialists. And we just wouldn't have that infrastructure without the innovative, creative spirit, the hard work, the compassion of Dr. Guthrie as an academic healthcare leader. The department today that exists in his legacy is the largest group of academic pediatric clinicians in the state and anchors 27 pediatric specialties. I can tell you in my brief tenure here as chair and in his shadow as the person who started this department, there's no question that the fact that he was such a effective clinician, a compassionate clinician, a clinician who through his words and actions championed education and research. We just wouldn't be the department that we are today without having had that call to arms early on with him as the first chair. So we sit here today with something very unique in the state of Kansas and in Wichita, a pediatric department that mirrors the missions of the school in clinical care education, advocacy, and research. And those really are those core attributes as an academic clinician and leader in healthcare that Dr. Guthrie really brought to us. You know, imagine if Dr. Guthrie has made an impact in the lives of children and adults with diabetes through his research. Just imagine his impact on children and adults who have been impacted by those he's taught. You know, it's very similar to dropping a pebble in a body of water and just watching the ripples go. You know, first and foremost, at the University of Kansas, we train physicians, not just pediatricians, even though that's obviously an area of passion that I chose and that Dr. Guthrie chose. But one of my fondest memories thus far in my tenure as chair of the department is walking into that department and running into Dr. Guthrie as he was leaving or getting ready to lecture the students. And I really enjoyed just slipping into that classroom and watching him, and all of these wonderful attributes that have been so beautifully described, are evident. His intellectual curiosity, his compassion, his technical and clinical skill and excellence, his empathy, and I know for a fact that even though Dr. Guthrie was always teaching about diabetes and endocrinology, he was really teaching those students how to become better physicians. And no matter what those students end up doing in their, in their residency or in their careers, they take a little bit of educators who are impactful, like Dr. Guthrie. And I know personally, because he taught me when I was a student at Wichita. We take that with us wherever we go, and no matter what discipline. And so just imagine the physicians and the patients really around the globe who carry forward some of that, those attributes that Dr. Guthrie shared as an educator. When I first arrived at Wichita as chair in 2014, literally one of my first meetings, I think it was the second meeting that I set up, was with Richard and Diana. And Diana, I hope you remember that meeting as fondly as I do. I was just so honored and touched to sit with you and talk about the department and ask for support and mentorship. And I received that a great deal. And there was never a time when I called either of you and asked for your attention that you didn't give that to me and offer me perspective and coaching and mentorship, and really became one of the most important sources of those things in my tenure here. And it just, to me, speaks to the dedication and the impact that Dr. Richard Guthrie has had and will always have as a true leader in academic healthcare. The last thing that I want to share with you, with everybody today, is just really quickly how the legacy, Dr. Guthrie's legacy, will always remain at the school and in the department. And again, I want to just emphasize that as I state that, I know that really is the doctor's Guthrie's legacy. And so Diana knows that as I share these things with a lens to Dr. Richard Guthrie, she knows I'm talking about her and their shared impact. I'm going to share my screen with you just for a second so that I can just share with you a few things so everybody's aware. Hopefully everybody can see that, but I want you guys to know that in the Department of Pediatrics in the School of Medicine, we have the Drs. Richard and Diana Guthrie Award for Excellence in Pediatrics, and this is really a highly coveted award that our faculty and staff pick out truly the medical student that exemplifies those attributes that we attribute to both Diana and Richard. And there's a big plaque in our department, and it features a picture of the student who wins this award every year. And we always strive, not only with our student selection, but in our faculty to meet this high bar that was set. And then a few years ago, I was so thrilled. I approached Richard and Diana about using some of the very generous funds that they had donated to the department to establish the student award to build the Guthrie Legacy Award. And I just couldn't think of a better way to begin to honor the faculty members who have dedicated their careers to the Department of Pediatrics and those that we serve, and really broadly across all the missions of clinical care education and scholarship, child advocacy, and or healthcare leadership. And so now we actually have this Guthrie Legacy Award, and we keep it very close to our hearts, and we don't give one out every year. In fact, we really just give them out when we find the special people who are living in that legacy that the Guthrie shared with this department. And then finally, I want to just tell you a little bit about this Bears for Kids program. So I was invited by Lindy to share this, and this was something that I think was very, that Dr. Guthrie was very touched by. But this past year, the department decided to build this program that would link the things that we do in supporting children and in our commitment to research with an opportunity for our community to join us in that. And we conceived of this Bears for Kids program, the Bears Enabling Advances in Research and Support. And you can see, I don't know if you guys can see, there you go. You can see our first little bear here that's with me and in the picture. And as we struggled to really figure out how we wanted to kick this off, I think we were inspired to realize that our first bear should be named Guthrie. So this is Guthrie. He's absolutely named in honor of Richard and Diana. We plan every year to have a new bear in this program, but we have indefinitely suspended the development of new bears. We're just going to sit with Guthrie for a while and keep that going in his honor. And so here is this. We had a really cool event. So grateful that Richard and Diana were able to be part of this, and Dr. Guthrie was honored, and he spoke, and really this program, it's the way that it supports children, both in providing comfort to sick children who get the bear, but also in providing support for research from the proceeds from the bear. I think just really speak to those attributes that Dr. Guthrie shared with us as a leader in pediatrics. And so I just want to share with you guys, promote this wherever you want, and this isn't really about supporting the department. It's about honoring Dr. Guthrie. And so if anybody wants to share this, here's how you do that. And what happens if you can purchase a bear for yourself, or you can purchase a bear for a sick kid, and the proceeds go to research, all in Dr. Guthrie's name. And so with that, I'll just close and express my really sincere gratitude for being part of this event. And thank you, Diana, for being a part of my life. And thank you for sharing Richard with me and with all of us.
Thank you, Dr. Pate. And there's a link also for the bears as part of the HUVA program that you can link under those med school and can order those bears. We'll officially kick off the program. And I thank all of the folks who shared their memories with Dr. Guthrie in the preceding half hour. I appreciate you taking time to share about the Guthries. So welcome to the Day of Diabetes Discovery. My personal journey with the Guthries goes back to 1974 when I was a nursing student. And Debbie and I have an ongoing kick back and forth about who's older. She and I actually graduated together. And we're in that same nursing class that graduated in 1975. And Diana was a community health instructor, I believe, at that time, and I got to visit the clinic, and she helped assign a child with diabetes to me to visit in the home, which is a whole lot of the reason I picked pediatrics as my specialty, and came out of a pediatric intensive care unit when the Guthries recruited me in 1979 to go to work for them. I could share a lot of history in that 40 years of working with Dr. and Diana. The planning for this day started as we began to plan the 5th Live Well with Diabetes event last January. And the plan was to highlight Dr. Guthrie's 85th birthday, which would have been today. We plan to celebrate it again on with the 40th anniversary of the first dose of human insulin, which he gave on December 19th. And I had the privilege of giving the 3rd dose at that time. But in 2020, nothing seems to have gone as planned. So here we are with a virtual meeting with Diana, but sadly, Dr. Guthrie passed away June 1st. Great Plains Diabetes Research was founded by Drs. Guthrie, Hume, and Nesmith in 1983. The mission was to fund local research, initially an islet cell lab, and then to promote Kansas research, diabetes patient and professional education. The board is committed to continuing their vision, and in 2014, when Dr. Guthrie retired, we opened the clinic to carry on the holistic approach to diabetes care. We've gone from a 3-person staff to a 10-person staff with nurse practitioner Amanda Ost joining me, in providing diabetes care and education, and Dr. Rami Mortada is our collaborating physician. He also brings his practice here a half day a week from the east side to the west side. This program came together thanks to the support of Health ICT, who has been provided critical planning, technical support, and financial support. In the documents section of the platform, you'll find resources to become a CDE and resources for development of diabetes education programs. We wanted a very special education event to honor the Guthries, who have literally touched thousands of health professionals all over the world, thousands of people with diabetes and their families through their clinical care, books, outreach, including one in Peoria, Illinois, and thousands of children through our camping programs. I reached for the moon and asked for 3 international known diabetes experts to be part of this program, and they all said yes immediately to honor the Guthries. Their complete biographies are listed in their speaker bios associated with their presentation. Our first speaker is Dr. Fran Kaufman, who is a distinguished professor emerita of pediatrics at the University of Southern California. Dr. Kaufman is a past president of medicine and science for ADA and is well known for her diabetes and camping work and expertise in diabetes technologies, as well as her advocacy work around diabetes and youth. Our second speaker will be Dr. Earl Hirsch, who is a University of Missouri grad, and this gave he and Dr. Guthrie a special bond since they both were graduates from there. Dr. Guthrie did his endocrine fellowship at the University of Missouri with Dr. Robert Jackson. Dr. Hirsch is a professor and the director of the Diabetes Treatment and Teaching Chair at the University of Washington School of Medicine in Seattle. Dr. Hirsch was instrumental in inviting Dr. Ampiras to join the day. He is the expert on diabetes technology in the hospital. Dr. Ampiras is professor of medicine and director of the Clinical Research for Diabetes and Metabolism Unit at Emory University.
And thank you everyone who's had nice things to say about the Guthries over the last half an hour or so. I'll echo everything that they've said. And I'll add in addition that the Guthries were really the first people in my medical education who convinced me that diabetes was more than kind of a mysterious comorbidity that patients had. Their diagnosis of diabetes was perhaps the most important thing to know about them. And not only that, it wasn't mysterious. We knew what needed to be done with people and for people to prolong and improve their lives. And so both as an endocrinologist myself and as a member of the board of the Medical Society of Sedgwick County, we just want to echo everyone else's gratitude to the Guthries for the contribution they've made to patients with diabetes and to awareness of the disease itself. So with that, I think we can turn it over to the speakers.